Now, so if there is outbreaks, how do I know which to be called as endemic, what to be called as epidemic, what to be called as sporadic, what to be called as pandemic? Right? So what is endemic? I like this example to do it with cows. Okay. So imagine you are in the rural countryside and you see 3-4 cows grazing in a field. Is it a natural occurrence?
Yes.
It's a natural occurrence. Okay. So will that alarm you?
একেবারেই না।
It will
No.
not alarm. Okay. So the fundamental thing that we have to establish before we go into understanding endemic, epidemic, sporadic, and pandemic is that even if the occurrence of something is high, even if it is expected, we are not alarmed by it always. Okay. I saw many crows in a banyan tree. Okay, it's normal for the crows to be there, right? Okay. So with that, we begin the concept of endemic. So what is endemic? Remember, it is like observing a few cows in a rural area. So it refers to the usual or expected frequency of disease within an area or a population group. The term is the habitual occurrence. Okay. Routinely, you will find that disease prevalent in that particular population group or in that particular geographic area. And then we will call that disease as a endemic disease. It refers to the usual or expected or habitual presence of a disease within a geographical area or a population group. The characteristic findings are A, there is constant presence in that area, and for that presence to be there in that area, you need not bring it. Okay? It is not a Siberian husky in the rural area. It is a cow. So it has not been imported. It is indigenous to that particular geographical area or that population group. Okay. So what are the terms that we must remember then in endemic? A, the occurrence is usual. B, we are talking of the occurrence in the usual occurrence in a specific population group or a geographic area. And C, such that the occurrence has not been imported from outside. It is routinely present there. Right? Clear? Huh? Three things: habitual presence in a geographical area and without importation from outside. Right? So, for example, sore throat in children. Okay. Malaria in forests. Okay. So, these are endemic disease.
ডিপথেরিয়া কি এন্ডেমিক হবে?
It will depend. So, a disease, can you say whether a disease is endemic or epidemic without talking of the population? So, you have to say কোন population এ কোথার মধ্যে ভাবছো. So suppose you're thinking of a population which is not vaccinated with the DPT vaccine and you are having children, okay, in a setting like India, in a low middle income group. So diphtheria there can be endemic. Okay. But once you're having this vaccination, diphtheria, we are not expecting the usual occurrence of diphtheria. So then it is not endemic. So if a particular disease is, so how do we know what is the expected frequency? That is the question then. Okay, what to expect? So the expected frequency is the average number of cases of the disease in the last 3 years. You can even use other time duration, but usually when we talk of what is the expected frequency, we look at what was the expected number of cases based on the last 3 years. Okay. Okay. So then there are two more terms. What is holoendemic and what is hyperendemic? So can anyone help me with this? What is holo and what is hyperendemic? See, hyper is, हाँ बोलो बोलो बोलो.
ইনসিডেন্সটা যদি অনেকটা বেশি হয় তাহলে সেটা হাইপার এন্ডেমিক হবে।
Not exactly that. This differentiation
হলো
most
এন্ডেমিক
often,
মানে হচ্ছে মানে মানে একটা রোগ যেটা হাই লেভেলে কনস্ট্যান্টলি একটা পপুলেশনে আছে, পার্টিকুলারলি ওটা মানে এই এজ যাদের কম, ইয়ং চিলড্রেনদের এফেক্ট করে, কিন্তু অ্যাডাল্টদের ক্ষেত্রে ওটা লেস সিভিয়ার।
very good. He is partially correct. So think, when will a disease affect children more and adults less? A disease, when will it affect children more and adults less? What is the fundamental difference between children and adults?
Adult have acquired immunity.
Fantastic. So for diseases where infection confers long-term immunity, once you have the infection, you no longer remain susceptible and you gain that immunity. So the disease will not usually find its incidence among adults. Whereas to the children who are new people into the population, who are not having the immunity, the disease will affect them. So the disease will have a high incidence and prevalence in children, but not so in adults by way of immunity. And that is a hollow endemic disease. Okay. Commonly you see with measles, chickenpox. Once you get the disease, you won't get it again. So it won't not have a huge burden in adults. But as far as the children are concerned, if you are not protecting them, it will rage a rampage on them. Right? What is hyperendemic then? So hollow endemic is it affects children more, but barely affects adults. Barely affects adults. That is hollow endemic. And here, that is by virtue of immunity. What is hyperendemic then? Hyperendemic is there is constant prevalence of the disease in the population. Not only that, it is affecting all populations, irrespective of whether it is children or adult. Now, when can this happen? This can happen if infection does not confer immunity. Okay? Characteristic point in case example being dengue. Dengue. You get infected with dengue, you have barely have any protection against dengue reinfection. Rather, a reinfection with a different strain will have disastrous consequences. Okay? So a hyperendemic disease is equally affecting all sections of the population, children as well as the adults, and having a continued presence in the population as a result of lack of immunity against the disease. So characteristic example being dengue. Okay? But both for holoendemic and hyperendemic, the fact is that they are usual diseases in that particular setting. Clear? Endemic, everyone is clear? Absolutely?
Yes, sir.
Fantastic.
ইউজুয়াল আনইউজুয়াল ব্যাপারটা বুঝলাম না। আনইউজুয়াল মানে ওই জায়গাতে যেটা হচ্ছে না,
বুঝে যাবে,
বাইরের থেকে কিছু এলো
আর
সেটা।
একটু এগোই বুঝে যাবে। হ্যাঁ, যেটা ওই জায়গার ন্যাচারাল নয়। ঠিক আছে? কোনো একটা আফ্রিকান ডিজিজ ইন্ডিয়াতে হয় না, সেটা হঠাৎ করে তুমি কলকাতায় দেখতে পেলে। Let me come to it. So endemic gap. Next, what is sporadic? So look at the pictures. You have a cow in the middle of a busy market, and you have a cow in the middle of a street. Okay. Now, what are these two pictures telling you? Is a
The
cow supposed
endemic
to be
আর
on the street?
sporadic
Huh? Huh?
the endemic আর sporadic এর ডিফারেন্সটা বোঝাচ্ছে আই গেস এই দুটো
Yes.
ভিলেজটা
So see, there are.
আর
So are there many cows here? No,
No.
just one or maybe two. Okay. And one is there in the marketplace, the other is there on the road. Is there any relation between these two cows? No.
No.
So scattered about cases without any apparent relation between them by place or time. Okay. So one case has happened in Lucknow, the other in Kolkata. One in March, the other in June. So scattered about cases of a disease without the presence of any obvious connection between the two cases, separated widely in space and time, are known as sporadic occurrences. Okay. Tetanus. ঠিক আছে, তোমার কেটে গেছে, খেলেছো, স্পোর কন্টামিনেশন হয়েছে, টেটনাস হয়েছে। না, এখানে তো আমার টিটানাস হয়েছে আর তামিলনাড়ুতে একজনের টিটানাস হয়েছে। ইজ দেয়ার এনি রিলেশন? নো রিলেশন। So this is sporadic cases. No apparent clustering of transmission. No apparent threat of an outbreak. Unrelated in space and time.
তাহলে সেই হিসাবে তো আমার প্লেগও তো হবে।
হ্যাঁ,
প্লেগও তো আমার এখানে হয়েছে, আর আর মহারাষ্ট্র একজনের হয়েছে, প্লেগও তো হবে।
প্লেগ তোমার ওখানে একটা হয়ে কি থেমে যাবে? প্লেগ কি তোমার ওখানে একটা হয়ে থেমে যাবে?
না, ও তো চলতেই থাকবে।
চলতেই থাকবে। টেটনাস কি চলতেই থাকবে? মানুষ থেকে মানুষে ছড়ায়
না না না।
না। So that is the difference. ঠিক আছে? So sporadic occurrences scattered about cases unrelated in space and time. Right? Then epidemic. What is epidemic? Too many. Too many. Refers to occurrence clearly in excess of normal or expected frequency. Okay, clearly in excess. Huge number. Clearly in excess of normal or expected frequency in a population, group, or a geographic area. More often than not, they will be introduced from outside. Why? Because if it was circulating in the population, then some people would have immunity. So the epidemic would never occur in the first place. So if we are having all of a sudden huge number of cases, clearly in excess of expected frequency, then definitely it has come from outside. Now, how to tell that it is clearly in excess of expected frequency? If it is more than 2 standard deviations above the mean. I again said expected frequency is mean of the last 3 years. So if the number of cases in this year is more than 2 standard deviations from the mean of the last 3 years at the same time of the year in the same location, then I will say that probably an epidemic is occurring. So the occurrence of a disease clearly in excess of normal or expected frequency. Right? Clear? Okay? No doubts? Okay. So next the question, can a sporadic case be an epidemic? Can a sporadic case be an epidemic? What do you think? One single case, unconnected in space or time to any other case, but it has occurred. Can that be an epidemic?
যদি কোনো নিউ কজেটিভ এজেন্ট মানে 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 হঠাৎ করে মানে ইনভেন্ট হয়
Yes.
যেটা
So what I said, what is epidemic? Epidemic is if the occurrence is more than 2 standard deviation above the mean. What if the mean is 0? What if the mean and SD of the last 3 years is 0? Then even 1 is greater than 2 standard deviations away from the mean. So even a sporadic case can be an epidemic, and the answer to this story is a cow in the bedroom. Okay? A disease occurring in a place where you are absolutely not expecting it at all. Okay? It has not occurred. The mean of the last 3 years was 0. SD is also 0. So there a single case can be regarded as an epidemic. More commonly, this is with zoonotic diseases. Diseases that were so far sequestered only in animals.
মানে এর
And
তো
suddenly
সবকটাই কারণ
it
কি
starts to infect one. হ্যাঁ
মানে সবকটা
বলো
কারণই মানে বলছি সবকটা কারণই এর জন্য বলতে পারবো পোর স্যানিটেশন এনভায়রনমেন্টাল ফ্যাক্টর ল্যাক অফ ইমিউনিটি সবকিছুর জন্যই স্পোরাডিক এপিডেমিক হতে পারে
sporadic epidemic হবে when it's a completely new thing that was not so far happening. For example, think of how COVID came. All of a sudden, it has probably come from or MERS or H1N1. বার্ডসকে ইনফেক্ট করে হঠাৎ করে হিউম্যানদেরকে ইনফেক্ট করতে স্টার্ট করলো. So the first case in humans does not have any previous case in humans for the last 3 years. So that is an epidemic. Diseases which are only sequestered in animals, the first case, the spillover event, এটাকে বলে spillover, a disease moving from animals onto humans. So there even a single case can be an epidemic.